Well, to health matters now, where the World Health Organization is calling on governments of nations to step up their level of commitment towards eradicating malaria, which is responsible for millions of deaths annually. The senior correspondent Jacqueline Ogo takes a broad look at malaria.
Malaria is a life-threatening disease known for killing millions annually, especially in tropical Africa. But it is a treatable and preventable ailment. It is transmitted by the female Anopheles mosquito, which carries the malaria parasite scientifically known as Plasmodium. When mosquitoes carrying the malaria parasite bite people, they transfer Plasmodium into the bloodstream, and such persons fall ill with malaria as the parasite attacks the life-giving human red blood cells. There are 5 types of the malaria-causing parasite. Doctors say amongst them, Plasmodium falciparum and Plasmodium vivax cause deaths when not successfully treated. World Health Organization statistics say in 2021 alone, 247 million cases of malaria were diagnosed globally. 619,000 people died same year of the disease. 77% of that figure were children under the age of 5. Nigeria accounted for 31% of the 2021 global malaria death record. The country is still battling with major factors which promote the spread of the disease, like dirty environments with uncleared bushes near residential apartments, stagnant water where mosquitoes lay their eggs and multiply. They breed faster during the rainy season. This is an area of Lagos State where mosquitoes are giving the people nightmares. They are crying out for help.
There's stagnant water here, and mosquitoes have been breeding here. So many things have been happening here. It has been laying egg, causing malaria to the children. Everyone here is not safe. As you can see, everywhere is just the water is so dirty, it's stagnant, the water is not going. So we need the government to just help us to do this road. The children here, their life is not safe here. The mosquitoes breed here, so it lays egg and causes malaria for them. So the time they are meant to spend in school, they are not in school, they spend it in the hospital. Their parents are going out to look for what they will eat, and when they are in the process, they are still coming back home to meet their sick children at home, spending money on them again.
The water is very, very dirty, and you can see mosquito laying egg, perching on it. We people that are staying here, it really affects us. The thing usually perch on me, and I do not like it, and I'll fall sick. And I do not like the mosquitoes drug that they give us, that malaria drug. I do not like it.
Apart from the fact that malaria is prone, very prone. I mean, thick, good, big mosquito are biting people. If I'm in production department, for instance, and I'm at home for 1 week, 2 weeks, 3 weeks, what happened to that production? So if there's nothing to produce, what happened to the inflow, the cash inflow? If the cash inflow is not there, what happened to this, the standard of living? So it's just a ripple effect it will going to have. But if everybody is fine, I can work at my optimal output. Yeah, I can give him more.
Doctors say for governments to reduce malaria burdens, tackling underlying environmental factors must be given topmost priority. There's also another key warning for the reduction of malaria death rates. Doctors say the most dangerous way to tackle malaria is through self-medication. They insist on medical consultation.
Every medication people take without doing it the right way on the prescription, using the right dosage, has a tendency of destroying organs, especially liver. So you can't just take anything anyhow. Usually things we see as symptoms. It is very important to see a doctor to find out the underlying cause of the symptoms, because 2 sicknesses can actually have same symptom. So are you sure it's malaria you have? You need to do proper tests to know, to have the diagnosis right.
Who controls the drug people go out to buy there? I know that the pharmaceutical aspect of healthcare is doing a lot in regulating the drugs that are sold to our people. But now I can still walk to, a pharmacy and request for some drugs and buy and just go away.
The World Health Organization wants to see malaria eradicated, but this cannot be achieved without the cooperation of nations. And in line with finding solutions, in 2019, Ghana joined Malawi and Kenya to launch a malaria vaccine implementation program targeted at the vaccination of children in 42 districts across 7 regions of the country. In February 2023, the country launched an expansive malaria immunization program, which is expected to deliver malaria vaccines to children in 51 additional districts. In Nigeria, doctors help prevent malaria deaths through the use of prophylaxis, which is a combination of tested and reliable malaria drugs. The WHO is encouraging more nations to actively join the search for lasting solutions. Malaria is more common in tropical Africa. This means the governments of the region must holistically tackle the disease to ensure the death burden is drastically reduced. Jacqueline Ogo, TVC News, Lagos.